Welcome today in Woburn. I'm your host, Samantha Stone, and I have a special guest with me today. We're going to talk all about things legislated with Senator Friedman. Thanks for joining us.
Thank you. It's nice to be here.
So we had like wild weather yesterday. It was both hail and sunshine. Not yesterday, Sunday.
2 days ago, yep.
So I've lost track of time.
Yep.
And today is kind of a nicer day out there.
Absolutely.
So maybe spring is in the air.
Springing. That would be great.
Spring always makes me think forward, right? And think a little bit about what's coming. It's a great time of year for us. You know, in my house, we empty everything. My husband's been making fun of me. I've like gotten rid of furniture. He comes home and there's like furniture outside in the yard. He's like, what happened to? But it's also a great time for us to take a pause and think about all the things that we've accomplished as a state and also all the things that are left to do.
Oh my gosh.
Right? And
Yep.
so much. So I thought we could just start our conversation today talking a little bit about the last few months because there's been a lot going on. So tell me some of the highlights.
So what are some of the highlights? So some of the highlights are that we did a big ARPA bill. So we got $4 billion from the federal government and for the state to spend according to certain criteria. Mm-hmm. And we, as the legislature, took $2.5 billion of that and spent it on things like workforce, on hospitals and healthcare, on education funding, energy, and then we were able to put some local earmarks in there, some things that matter to our community. So in Woburn, there was I think about $125,000 for accessible playground equipment in public spaces. There was a downtown renewal fund that we I think got about $125,000. And then one of the things we did, which I actually feel very good about, is we started a pilot with the Woburn schools and the Burlington schools to provide primary care to students who are low income and who are having trouble getting access to care. And why that's so important is because kids can't come to school unless they have their vaccines and their health records are up to date. And so this pilot actually started. They had the first one, I think, last week or 2 weeks ago with Tufts Medical and Tufts Medical students, and it was like a huge success. So we'll be doing that for a while. So that was the ARPA bill. We did a climate bill just last week.
Before we leave ARPA, I just want to ask you a couple questions. You know, it's an almost overwhelming amount of money that came, and yet when you start to divide it among communities and you start to divide it among programs, it goes quickly.
Very quickly.
I'd love to just get your sense of the process we go through to help prioritize where we're going to make those investments so that we don't water them down so much that they're not very effective.
Sure. So I think the first part of the process is that you have to look at is what's happening right now and where are we currently really hurting, right? So there's lots of good causes out there. But for instance, our hospitals lost millions and millions and millions of dollars during COVID. Well, it's really important to keep our hospitals up and running. So, and you could argue housing, food, healthcare, then possibly, education, transportation. But let's look at the first three things first, right? Housing. Do people have housing? Do they have food? Do they have healthcare? How has the pandemic affected that? Well, there were major upheavals in all of those places. And so a lot of our money went into housing, went into food and food security, and it went into healthcare. And especially, and then there's the workforce. Workforce is really important. It's important for the people because we need jobs, but it's also really important to fund our critical services. A lot of money went into healthcare. So it's really looking at the crisis points, because this money, remember, came because of a pandemic, right? So we know our crisis points, and it's hard to make those decisions because I don't think I saw anything that at least came out of the Senate that I felt was unworthy. I don't see anybody saying, "Oh, let's let's do this because we can, build a bridge to nowhere. And that didn't happen. But we did very consciously say, how much money do we need right now for these kinds of things?
Let's talk a little bit about that healthcare money. What is it? I'm not sure I understand where it goes to. So I know it's allocated. I know it's meant to help supportive infrastructure in our hospitals and medical centers that did take a very big hit, and whose staff is tired, and all the things that we know to be true about that, and are still working very, very hard and trying to catch up, I know, from lots of elective procedures and things. How do they use these funds? Is it allocated to individual medical facilities to use as needed, or does it direct to certain kinds of expenses?
It's both. Okay, we do it in a couple ways. So right now, for instance, this can get really complicated. So hospitals get paid, people in hospitals get paid for services that are rendered. Many of those services are covered through Medicare and Medicaid, okay? So one way that we allocate federal dollars that come in is based on how many Medicaid patients you have, right? And so hospitals that have what we call high public payer rates and low commercial rates tend to suffer the most because Medicaid does not pay dollar for dollar for a procedure. So if a procedure costs $1, Medicaid would give you 85 cents. So those hospitals have a much less ability to weather a storm, whereas a hospital that has a high commercial rate, and they've negotiated those rates, they have some padding, because they're getting, on whole, they're getting paid more, okay? So one of the things that we look at is, okay, who is in dire needs? And those tend to be our public payer hospitals, right? So that's one way we allocate the money. And then it's also based on how many assets do you have, and where, how can you get access to money if you need it in these lean times? And we want to keep those community hospitals open. The second thing we looked at in here is the incredible pressure of workforce. And you noted it, right? We have incredibly exhausted healthcare workers. They, in fact, are leaving. They're not coming back. They're really burnt out. And we have huge workforce issues across our entire healthcare system. So we looked at, what can we do? How can we get people into the system? How can we get them to stay? And we did a couple things. Very, very large, 120 million or so loan repayment program. So if you work in a community-based setting or you work in an inpatient, we will pay your loans if you stay for 5 years and you work full-time or almost full-time. We funded some programs that are just wellness and healthcare programs for providers, right? So people can have some access to mental health treatment, stress relieving, those kinds of things. And we went to our hospitals and we went to our community centers and said, what do you need? And this is what we got back. We need to help people stay here. We have to get rid of their loans. We have to make sure that they have an environment that they can work in. And it's been incredibly difficult. I think we forget sometimes that in a healthcare setting, that doesn't mean they have great access to all the healthcare that they need. No, exactly.
Right?
There's just as much trouble, right?
Because they're busy and they're tired and they want to go home and all the things that go along with that. So thank you for taking that digression. I want to talk a little bit about housing. Sure. So I have lived in Woburn now over 25 years. It's definitely home. I feel incredibly fortunate that I bought my house 25 years ago.
You and me both.
I don't know, I certainly couldn't buy the house I have now, in today's dollars, and I feel fortunate that we were. Even rent has, skyrocketed. I have young adult children who I loved dearly, and some boy they're going to want to move out of my house and have their own places, and it's increasingly difficult to envision that being able to be in Woburn. progress is good. It means that our house values are going up, but it's also really hard for people on a fixed income or who are younger and starting their careers, or all the things that go into it. What are some of the ways that we as a state are trying to help support families to be able to stay where they are?
It's a very, very big nut to crack. I think the first thing that we as a state are doing and need to continue to do is ideally what you want to do is expand your hub, right? You want to say, if you work in Boston or Woburn or the greater Boston area, we want you to be able to get there, but we want you to be able to live farther away. But we don't want you to have to spend 2 hours in your car to do it. So public transportation becomes really important, and there's a big push. We just okayed the South Coast Rail coming from the southern part of the state up into Boston. There's a big push to get a West Coast Rail, a western part of Mass to here. But so that's some things we can do. We can build an infrastructure that supports people from living further out. But we also have to increase our housing stock around our hub. And that's one of the ways that the state is trying to do that, is to encourage housing around transportation hubs so that people can get easily back and forth without getting in their cars. But there's also other pressures, right? We have this incredibly vibrant community, and people want to come to this state, and people are willing to pay enormous amounts of money to be here. And, one of this is, are you willing to make a little less money and build housing that people can afford? Not are you willing to take a less salary, but developers make an enormous amount of money out of a certain kind of housing that's luxury housing. So that sort of drives it up. Now, what can we do as a state about that? Well, we're a capitalist, economy, and people get to charge what they can charge. But we make it pretty easy for that to happen. And we also, if you go down to Boston and look around and see who's buying those huge luxury, apartments, they don't live in this state. They don't live in this country, right? So can we as a government do more to tax those people, to create a fund to build more affordable housing? And affordable housing is affordable for people who are making $100,000 a year. We're not talking about, we're talking about a whole range of income up to a fairly high income. And we can't sustain our economy if we don't have a full range of economic earners in it. So it's a very difficult issue. People don't want the government to be in their business, and yet it's the government who's going to try and balance that so that there's more affordable housing, less luxury housing. So it's not my area of expertise, but I'm kind of watching it, and I care very much about it. So.
Yeah, thank you for sharing that. We've had some big developments here recently in Woburn, and some of which is designed to do what you described as near the train station, right?
Yeah.
So hopefully there'll be people maybe who are commuting, or some may be working here, but giving us more options. We've built up Woburn Villages and some other things, and we'll see how that plays out. But that's part of that.
You are a very good example of what's going on, and it comes with its pros and cons, right? You're going to have more people. People don't want and yet you're building your housing supply, and as you build your housing supply, if we all can do that, then the pressure diminishes, and the prices can stay more in line with what people are making. But it's a huge problem. I could never bought my house. My house in Arlington, when we bought it, was $49,000, and we thought it was a lot.
Yeah, I look back now, and I've never felt so fortunate.
I know.
I feel really lucky, and we have no intentions of moving at any point in time, but it is a starting reality. When I sat down with my now adult young children, and we started to say, well, what do you need to save to buy your first house? And the numbers were looking really, really big.
I also think that young people today are coming out of education, which we desperately need them to get, with an outstanding amount of debt.
Yes.
And when you look at the debt that so many of them are carrying, it's a mortgage.
Yes.
And you add health insurance to that, and you add childcare to that, and you've now made it almost impossible. So the government, the state, can do more around reducing the cost of health care. We can address the issues, and not so easily on a state level, but on, education debt is outrageous. It's ridiculous. People shouldn't be, leaving with, especially their social workers or their nurses, and they're leaving with $100,000 worth of debt, So that's places where we could take some of that pressure off, and then your money would go much farther.
Let's talk about climate, because that was one of the big initiatives. So tell us a little bit about what's been going on there.
So there's been a real push to try, and I'm going to do a disclaimer. So my area in the Senate is healthcare. I am not a climate expertise. I sort of look to my colleagues who are the experts and who spend a lot of time looking at this. And I look to them for, okay, what are we doing and what should I be focusing on? But I think the issue with climate right now in the state is we have a requirement to get to net zero by 2050. And so what the climate bills are tending to do is to change things, to modify policy so that we get to our goals. And it's really focusing, part of this bill focused a lot on reducing emissions. It turns out that cars still continue to be the biggest emission drivers right now, much more than, say, public transportation. So there's been efforts to try and, to incentivize electric cars and to try and get people out of their cars. Now, having said that, if you live in certain parts of this state, you can't get anywhere if you don't have a car. So, we've focused on it, on energy, on the transportation sectors, and the electric vehicles, and seeing how we can increase usage of all of them, support the energy sector. Lots of debate around new construction and whether new construction can be all electric to reduce the use of gas, which turns out to be quite a polluter and not so great for you. I've been a big gas. My whole life is like, I want a gas stove, and we're slowly finding out, maybe not so good, maybe not so good.
The cook wannabe in me is pained by that truth.
I know.
It is. I find it is easy.
Yeah.
But those are those really complex issues, right? So some of this stuff seems incredibly straightforward, but some of this straightforward, easy things we've done, and so now we're trying to change big behavior types of things that are big. And your vehicle is a big investment.
Yes.
And if I want to move to electric vehicles, now I need a charging station.
Right.
Well, maybe not. My house can do it. Certainly, if an older home like me, that's I have to have something specially put in to do that.
Yeah.
Right.
And electric. While when it was costed out, the cost of all electric in construction versus gas, it's really minimal. It's really not. Especially when you're building new construction and you're insulating it, electric really does not come out to be much more expensive. Electric is more expensive on a monthly basis. So what do we do about that, and how do we address that? Plus, do we have the infrastructure to support an increase in our electric grid? So those are all real problems and real issues, and there's the other side of it, which I completely understand and hear, is we don't have much time. This is really serious. We are warming at a far, far faster rate than we're going to be able to handle. And in fact, I was reading something yesterday that was talking about how there's going to be food shortages in the United States as early as next year, and that will have a huge effect on people, and it's because of climate change. So
that's a huge thing. I mean, I look back at what happened during the height of the pandemic. We had shortages in things. We certainly didn't have a food shortage.
Right.
We could get food, but we had shortages in certain types of food or certain types of products. And it was the first time when I was young, I lived out of the country, part of which was spent in West Africa. And it was the first time that in my adult life where I had those moments of I need to stock up on things, and I'm not always going to be able to get exactly what I want. And it was probably a good reminder, a little shake up to get me back on my toes. My husband's, we're still eating the pasta that I bought. In reaction to that, I probably went a little too far for pasta. But those are very real things that we're not. We have farming in Massachusetts, but it's not a predominant industry for us like it is in some other states. So we're probably seeing and feeling the effects of that more perhaps in other places, but we need to heed those warnings.
90% of our vegetables, or at least 90% I believe, come from California. And look what's happening in California. What happens when those wildfires come, or the storms come, or the drought comes? I mean, we are part of a global world now, and we forget that at our peril.
So in addition to the things that you talked about where your colleagues are really focused on trying to solve reduction in energy use and things, when it comes to things like sustainable farming and greater reducing food scarcity and making sure, are there other things that residents should be aware of, should be thinking about as they're trying to do their part? I know, for example, there's a movement around composting. It's not as easy as we might all like because it isn't as, we don't have as many people using it. The more people who use it, the easier it is to get service, right?
I think one of the big ones that I would think a lot about is our food waste. We waste, as Americans, an inordinate amount of food. And we've been taught sort of by an industry that if an apple has a spot on it, it has to be taken off the shelf. And we kind of expect our vegetables and our fruits, for instance, to look a certain way, which has nothing to do with the quality of them. So I think, first of all, there's a real movement now to rescue some of that food. And you've got places like FoodLink, which is exactly what they do, is they rescue really good food from being thrown away, and then they redistribute it. So that's part of a movement that if we could really focus on rescuing some of that food, there would be a lot more food in people's bellies, right? But I think it's also we need to change the way that we look at things as a consumer, and make sure that, first of all, we're not wasting food, that we get what we need, and that's, sometimes hard to do, especially when my husband does the cooking. But also, how are we, what are we expecting our stuff to look like, and what's good food and what's not good, and really knowing what that is as opposed to what we're being told by an industry whose business is to make money.
I'm so glad you brought that example. I watched a show forever ago, like on the Food Network. I don't remember which one it was, but they did a whole episode on chefs coming in, and what they talked about is they generally come in and look for the best looking produce, right? They do that, but they went in and they basically had to use all stuff that was being thrown out, things that weren't going to make it to the shelves, and they made these beautiful, fabulous meals that were wonderful. But it is a reminder that, especially if we want to support local farms and other things, everything doesn't have to look perfect to be really
and if you don't
yummy.
want your stuff sprayed and have wax on it and all those things that really we shouldn't be putting, I don't think, in our bodies, your fruit's going to look different, right? And that is okay, or your vegetables and stuff. So anyway.
I'd just be happy if my 21-year-old would eat fruits and vegetables.
Just wait.
Someday I have a dream that everybody will eat what's put in front of them at the dinner table. Not holding my breath, but I can hope that happens. Let's talk about some of the other things that have been going on. I know we had, very local to Woburn, some legislation to help allow the mayor to assign library trustees. And that took a while to get there. And what was your hope in supporting that and helping that get through? So
I am a firm believer that there are many things that towns should be responsible for. It was not the business of the state to get involved in that. One of those things I think of, for instance, is liquor licenses, right? I really don't think that the state should be in the business of deciding whether Woburn should have X amount of liquor licenses. I don't think that the state should be involved in how the trustees are appointed of your library. Now, are they following the laws? Is it constitutional? Is it morally, abhorrent? I look at those things, but I really believe that it's really up to the town. That's your library, for instance, and you all need to do what you need to do as a town to have it work in the way that you see it working, right? And you can see just how hard it is sometimes to make changes just within the town, then, take 10 times that and see what it's like to do at the state to make a change in policy, and then just multiply that by hundreds to get something changed in the federal government. There's a lot of people, and they have opinions, and they believe as strongly as I do in an answer to a problem, and it's not necessarily the answer that I would pick. So yeah, I don't have a lot to say about that, but I think it is a process that a town should go through, and that the state should say, this is your decision.
We talked a little bit earlier about healthcare, which I know is a passion and focus of yours, which we're grateful for. We're lucky to live in a state that has pretty incredible healthcare. I know not every part of the state has easy access here. In Woburn, we have pretty easy access to everything down in Boston, but also some great hospitals here locally. And I think there was $300,000 that was allocated towards, I guess it was like equitable medical access. Is that the primary care program? I just want to make sure that I was connecting the two things together.
That was the primary care program for kids in Woburn and Burlington who, need access and are having, had trouble getting it, and then can come to school.
Yeah, so. I think it's great. So tell us what happens. So we have a pilot, we're testing it out.
Yeah.
Seems to be having some good and helpful results. What happens next at a program like that?
Well, sometimes the pilot, if you keep moving it enough, it actually becomes embedded. And this is I think what this is really speaking to is access to primary care, okay? And a lot of people don't have that access. And so what happens is they end up going to the emergency room, they end up getting sicker, and we're really focusing on making sure that access is available across the board. And Woburn's a very well-run, great town, access, as you say, but these kids didn't have access. Yeah. They didn't have access when they needed it. And their parents, it just wasn't working. So what we have to make sure of is that we have a healthcare system, especially primary care and behavioral health, that is accessible and is covered for as many people as we can. And that means, do we have evenings? Can you get to your primary care on a Saturday? What gets covered? Does somebody there speak the language, right? Because that was an issue for some of these kids, right? Their parents weren't native English speakers, and they didn't know how to navigate this system. And that's all something that we've got to come to terms with, And so I think we'd want to find a way to continue this, but to open it up so that, okay, does the Woburn-Burlington area need this? Let's figure out how we can sustain that. Does this area need it? Let's figure out. And let's put our focus on the just fundamental primary care and get people hooked up with primary care physicians. And I will maintain that our quality of healthcare will go up and people will be healthier.
I think I forget personally, and I'm sure a lot of us do, how inaccessible it can be for people. I take for granted that we call the doctor up and we've got an appointment the next day. And I buy private insurance because I run my own company. And so I buy and I spend a lot of money on my health insurance, but that I have very good access to a lot of things. But one of the things, even with very good access, that's been a problem, and you mentioned, is behavioral health. People are struggle, even when they have health care that covers behavioral health, there are not enough therapists, particularly for children, but across the board, but particularly for children, who are taking new patients who have the bandwidth to take this on. And I'm sort of horrified by the waiting lists for people who are struggling and who really just want help. Are there things that we can do to make that better?
Yes. So one of the pieces in the ARPA bill is very directed to behavioral health, to child psychologists, to social workers, to licensed social workers, licensed mental health, and getting those people into the system and have them stay in the system. So we've done a lot of work around that, and a lot of that is around loan repayment. We also passed a bill in the Senate that's called the Mental Health ABC 2.0, where we have required that the Department of Insurance become much more effective at ensuring that there's parity between mental health and physical surgical health, which there is not, even though it's the law of the land. We're requiring insurance companies to raise their rates for mental health. It's been a long time stepchild of a big system where people say, you know, oh, I don't know, we'll carve that out, we'll give it to another company,
Yeah.
do what you want to do with it, but we don't want to know about it, it's expensive, and make it less expensive. Well, behavioral health care is not less expensive. And if we start looking at every part of our healthcare system at cost first, we will never solve this problem. So this bill really, first of all, says you got to raise the rates, and DOI, Department of Insurance, has to do a better job of ensuring that there's parity, and if there isn't among our insurers, then they need to enforce the laws. So those are a couple things. We've done a lot of work in the ED at emergency department where kids are sitting. We've require now for them, the Senate bill requires a portal, so a provider in an emergency department can sit down and say, okay, this child is here, where's an empty bed? Mm-hmm. Usually they could spend hours and days trying to just trying to find a bed. So more support in the emergency department, requiring there to be a behavioral health provider in an emergency room. So when someone comes in, they get care from somebody, they get an evaluation from somebody who understands what's going on. So those are some of the things. I can go on if you want.
Yeah. Well, I would let you, but I won't make you. I'm intrigued by it. One of the things that I know was driven by pandemic response was the enhancements to our ability to use telehealth.
Yes.
And I know that telehealth doesn't necessarily solve this particular issue of behavioral health, but the more options we have to serve people in flexible ways, I think in general is a good thing. Right. Do we anticipate any rollback to any of the flexibility that we've put there? So
we enshrined in law that behavioral health, telehealth will always be at parity. So if inpatient would be the same as a telehealth visit for behavioral health. And that at least sets, now we have to raise the bar for how much we pay for behavioral health care. But that's forever. We put in the bill that chronic care for diseases of chronic, like diabetes, high blood pressure, et cetera, that telehealth would be at parity with inpatient for 2 years while our Health Policy Commission, which studies and recommends how the healthcare, all the aspects of the healthcare system, they did a study on what the cost was, what the issues were, but we wanted that to be in place for 2 years so we could see, we believe that we should have telehealth for chronic care. It took so long for the regulations to come out that now we have to push that out so that parity for chronic care continues until, for the 2 years that we wanted to see it. And primary care is included in that as well, so.
There's a funny little, well, it's probably not a funny little thing. It feels funny when it happens to you, which is in order to have a televisit that's covered by insurance, or at least the insurance that I've been in, and I've heard a number of people, you have to physically be in Massachusetts for it.
Yes.
Is that I'm sure it's by design. I'm not sure
Yes.
I understand all the whys. I'm curious why that was put in place.
So every state has its licensing laws for healthcare, for doctors, for nurses, okay? So when you are in a state, you are covered by that state's laws. If your doctor isn't licensed in that state,
That makes sense.
then if your doctor does something in that state that is, they're not covered. So we can't allow, unless we have a compact with that state where all of our licensing is similar, all of our rules and regulations around the delivery of healthcare are the same, we can't allow that doctor. So that doctor can't practice in that state because they're not covered by they're not covered by a liability insurance and so then the insurer says, you're not covered, I can't cover you. I can't cover that, in state.
That makes sense. I'm glad I asked the question because I knew there was a reason, but I wasn't sure what the reason was.
Yeah.
So that is helpful. So when it gets frustrating, we know that there's good reasons
Sometimes,
for
yes.
it,
Sometimes there's good reasons. Sometimes there's, what were they thinking?
This is great. I'm just checking my notes to make sure I asked you about all the things that I really wanted to cover today. There's a couple other things that I know that you've worked on. One of which I think is it the Crown Act? Was sort of what it
Yes,
was
the
referring
Crown
to.
Act, yes.
So talk about that because I was really touched by it.
Yeah, the testimony was really compelling. The Crown Act just makes it illegal for people to discriminate against somebody's, how they use their hair, how they I don't know what the word is, but you can't discriminate against somebody because of their hairstyle. And this came out of a case that happened in a charter school where some two girls, they were in high school, were sent home because they had crown rows, and that is, cornrows, I think, and that is their natural hair. And they were discriminated against. And they, went through a whole series of things where they got detention, and then they got suspended, and then they got expelled. And it was really seen as a real discrimination against somebody's natural hairstyle. And so the state passed, the Senate passed an act. People with alopecia who don't have, who have to wear a wig or have, it's just to stop the discrimination against that.
I was really touched by just some of what I read about it and things. And so I mention it because a lot of times we get lost in a lot of the big things, right, that are budgetary, but there's a lot of decisions and legislation and things that is about our values as a society and supporting those values.
Yeah. And what was really amazing was these two young women, who were at the time 16, I think, they stuck to their guns. They said, okay, we'll take the consequences, but this is really important to us. And their parents supported them. And the school actually finally had to change their policy because they couldn't come up with a reason of why.
Right.
Why? What are you doing? Why is this a policy? Other than because you have a personal position on whether you like the way someone wears their hair or not, right?
Well, I love it. I think that's a really great example of, like I said, living those values. I know that you are involved in so many other things. There are a couple others that you want to mention that I didn't ask you about. Did I cover them all?
I think you've covered them all. I just,
Oh, it has been such a pleasure. Thank you for joining me. Before I let you go, I just want to ask one more question, and that is, I think we as citizens need to take accountability for ourselves and how we interact with our government and what we ask our government to do. And it is a uniquely American opportunity and thing, the way, as much as there's flaws in everything we do, there's tremendous opportunity here. What is your wish and hope for for all residents in Woburn to just get civically involved and be engaged in their government?
I think it's really, really important, and I think what's really interesting is it's easy for a lot of us to focus on the federal level when so much of what affects us is at the state and local level. And I really think we suffer from a lack of civic education, but I also think now we're lacking from a lot of civic just discussion. And I just would like people to remember that, you know, you can't just paint everybody with a broad brush. You know, I am not a corrupt politician. The people that I work with are not corrupt. We're trying to do the best we can. You absolutely may not agree. Lots of people don't agree with the position I take, but what I try and remember when someone's talking to me is they're coming from the place that they believe in, not a place that they want to make me wrong, but that they believe in. And I think it's the same for your elected official. For a lot of, you know, and we're your neighbors. We're not some like hoity-toity people somewhere out there. You know, we're like, I'm outside gardening and all my neighbors walk by and people talk to me about the plants. So I think really knowing about your government and caring about that and really understanding the role they play, and also that we're not all painted with the same brush. Most of us are actually just regular old human beings. We put our pants on one leg at a time.
One leg at a time. I love it. I love it. Well, thank you so much, Senator, for joining us today. And Woburn, please continue to take good care of each other.